Now, Dr. Newman, when it comes to Chinese medicines, you got a master's of science in Oriental medicine. Tell me about just that experience, what that was like, and what were the biggest takeaways that you've now kind of implemented in your practice with Chinese medicine.
Great question. So my specialty is in Oriental medicine, Chinese medicine, acupuncture, but the medical program was integrative medicine. So we had the same rotations and courses as any other physician. Our program was 3,000 hours. Um, there was 1,000 hours of just clinicals as a part of that work, and then national exams, boards, and so on, just like any doctor. Um, but the couple main things I took away from that was, in fact, yes, we can integrate what we do. I was experiencing it at least on the level of education, so I knew it was possible. And number two, I began to understand in what ways we could treat a person holistically and make a big impact using natural medicine as a first choice rather than as a sometimes distant alternative. How powerful it is as a primary healthcare system, not just something for, in acupuncture's case, is good for pain relief, but it's useful as a complete medical system. Anything from flu to heart disease to cancer, fertility problems, you name it, anything you would see any other doctor of whatever specialty, you can use acupuncture and Chinese medicine. It integrates well, and that's usually what I recommend is something collaborative. You don't have to leave your current doctors or therapists or coaches. You can coordinate what's happening here with what you're experiencing in other healthcare environments. And it doesn't have to be either or. It's an alternative, true, but it's also complementary. And that's what I advocate for. And it was impacted over my experiences there and since. In 25 years, I've seen people, and they one case, she treated herself for nutrition and really cleared breast cancer. Okay, she was only coming to me for lab work. That's how powerful nutrition is. Going back to what you said, she resolved it herself, a patient herself. Anyway, and I'm amazed. Acupuncture resolves fibroids. People start with panic attacks, and within a couple of weeks, I mean panic attacks like several times a day, panic attacks, and within a couple of weeks, they're relatively fine, and not just fine, but they're thinking about thriving again. How cool is that? People get pregnant, and they've been having trouble doing so. I'm always amazed at how helpful acupuncture can be even after all this time. And for pain, yes, but for so many other things. And then you recommend nutrition and herbals and meditation, other components that somebody puts into practice in their lifestyle. And then the most rewarding thing is when the clients come back and tell you with their feedback, what's happening, what's their experience, how is it working for them? And I'm learning things from my clients who are applying these methods in ways that are unique to them, not unique to my own mission in life, and so on and so forth. So it's great. And the platform that was created using a holistic approach, Chinese medicine was just a vehicle, set the stage for all of that. Things that are possible that just are sadly not possible in Western medicine or conventional medicine because of various reasons, philosophy and approach being just one of them.
Wasting my time.
You just can't help yourself, can you?